Hey everybody, how you guys doing today? This is Jim from the Pain PT. Good to see you all today for evidence of the week. I'm going to go through some more evidence today that I could share with you here to support the work we're doing at the brain and nervous system level. And this includes working with the psychology more than the physiology. The psychology more than the physiology. But as you know, and have heard me talk about before, your mind or your brain impacts your body through the nervous system, through the autonomic nervous system. And this can include things such as your beliefs, your emotions, your past, the associations the brain makes, the conditioning or learning that it has, the association. All these different things, including sensitization, are all factors from the brain that can influence your body and how you're feeling. Today, we're going to highlight emotions again because emotions is one big component that has been studied and is being studied more and more when we look at chronic pain and other chronic ailments in the body. So let's get to the evidence of the week here, everybody. Today's title of the study was a 2022 study in the Journal of Pain, a longitudinal relationship between emotion regulation and pain-related outcomes. Again, results from a large online prospective study. So again, this study had a number of people in it, had a good number of people. So it wasn't a small study. It had almost 1,500 people in this study. And what they were looking for and looking to identify was how much emotion regulation and specifically what's called alexithymia played a role in people's chronic pain. Now, again, some of you may have heard me talk about that word. Some of you may be new here, never heard of this word alexithymia. It is a real word. It's been studied a lot, actually, but not many people know about it. Alexithymia is a term that says difficulty identifying emotional feelings. Knowing what you're feeling emotionally or describing your emotions, having difficulty with that because of probably what you've learned from your upbringing or how you relate to emotions. In the past, alexithymia has been linked pretty conclusively with increased chronic pain, depression, and anxiety. So they wanted to look at this more specifically here, and they wanted to determine the extent to which general difficulties with emotion regulation at baseline related to pain severity and pain interference at a 3-month follow-up. Okay, above and beyond pain catastrophizing and pain acceptance. So I'm going to talk about those two things here as well because there's research supporting both these things in different directions. But they wanted to see above and beyond pain catastrophizing and pain acceptance. Was there a influence from how we regulate or how we identify emotions and pain 3 months later? Okay. So again, they say here in the introduction that it's unclear to the extent to which an individual's approach to managing emotions more broadly relates to pain-related outcomes. And recent emotional science theory states that emotion regulation occurs by first identifying one's emotional state and then next engaging in strategies to either upregulate, enhance, or downregulate or lower the emotion. Okay, so the first step, and I say this all the time, is we need to identify what are we feeling? What are we dealing with this emotionally? What am I feeling in my body? What emotion is this? Then we can move into strategies to how to deal with emotion. These two other factors that looked at here, pain catastrophizing, you heard me talk about catastrophizing before, which is negative thoughts, thinking, mental thinking, you could say that's negative around your symptoms. What we see here is that's a negative cognitive component towards pain. And again, that's been shown in the research to make pain worse, to make symptoms worse for somebody, as you could imagine. And it's been linked with the development, persistence, and severity of chronic pain. On the other side of the coin, chronic pain acceptance, which is also something I teach, the acceptance and allowance of the symptoms, is associated with lower pain intensity, improved pain-related functioning, and improved psychological well-being. So we have evidence for both these things in opposite directions. Catastrophizing, going to make it worse. Acceptance of the pain and symptoms going to make it better, have a positive effect. One's considered adaptive acceptance, one's considered maladaptive catastrophizing. So in the study, they looked at these two things, but more importantly, what they were looking at was this alexithymia, was the ability to regulate emotions specifically above and beyond catastrophizing and acceptance. Did it have a effect on the pain? Okay, 3 months later. And so what they found here, as we scroll down to the discussion of the results here, I'll bring this to this here. The current study determined the extent to which general difficulties with emotion regulation were associated with pain severity and pain interference 3 months later, above and beyond the pain specific emotion regulation. Okay. And again, this is the catastrophizing or acceptance. And what they found here when they removed the catastrophizing and acceptance as being part of what made pain worse, they found that greater alexithymia, specifically difficulty identifying and describing one's emotions, that's the definition of it more or less, emerged as a statistically significant predictor of pain-related outcomes. Findings suggest that alexithymia may be valuable to assess alongside pain-specific emotion regulation strategies in order to better understand pain-related outcomes. So it's an area we need to look at. We need to see for you, is this something that's true for you? Difficulty identifying and describing your emotions. Because if you have alexithymia, there's a good chance it's playing into producing or even enhancing the pain or symptoms you have in your body. And they say here is that this first stage of emotion regulation, like we mentioned earlier, is identifying what you're feeling, right? You need to know what you're feeling before we can regulate that feeling. Alexithymia reflects difficulties with the first stage of emotion regulation, emotion identification. So identifying how you feel. People with versus without chronic pain have reported higher levels of alexithymia. So we see this in the research. And alexithymia is related to higher pain severity and pain interference in other studies, as well as greater depression and anxiety symptoms. So it has been shown in other studies to be related to these things. And consistent with the present studies they found here, prospective studies have found that alexithymia predicts poor pain-related outcomes. So again, people who have difficulty with identifying and describing their emotions can also have worse outcomes. And I'll talk a little bit more from what they say here as to what's happening or why this is happening. They say a difficulty with emotion identification can have cascading effects that impair one's ability to select and implement strategies to successfully alter emotional trajectories. Elevated alexithymia may capture a broader and more robust emotion regulation difficulty that contributes to difficulty functioning despite chronic pain. Pain demands attention, they say, particularly when the threat value associated with pain is high. Remember, we talk a lot about how pain is a threat to the person. And they say here that hypervigilance towards the pain may detract attention away from relevant effective cues, hindering emotional awareness and contributing to poor pain-related outcomes. This sentence is really important, everybody, because it brings us back to some of the work of Dr. Sarno. It reminds me of Dr. Sarno, many of you know about, read about his best-selling books from the 80s and 90s and early 2000s. Hypervigilance towards the pain. So as we focus more on the pain and on the physical symptoms, they say may detract. And Sarno says it was a distraction, right? And they say it may detract. So it may pull us away, may detract attention away from relevant emotional cues, meaning we're not picking up on the emotion, we're not connecting to the emotion because the physical sensation or symptom is so high, our brains are going to the physical symptom. And so that hinders our emotional awareness and contributes to poor pain-related outcomes, meaning we're focusing on the physical symptom and sensation now. We're not going towards the emotion. Because we have difficulty identifying it, it's coming out of the body as a physical pain, physical symptom. We're not making the connection that it may just be an emotional reaction that you're experiencing in a physical way. Again, they found that pain acceptance remains significantly associated with pain-related outcomes, so it's helpful, something we also want to do. And pain catastrophizing, yeah, not so good. But the pain acceptance is something we also want to work on here, acceptance and allowance. But I'm highlighting today this alexithymia, which again, this is difficulty with identification of your emotional state, what you're feeling emotionally, describing your emotions. They do say here that more research is needed to clarify the role of emotion regulation in chronic pain. There's been studies, but we need more. And they say the findings of the current study have implications for intervention. Chronic pain or chronic symptom interventions often emphasize pain-specific emotion regulation. For example, reframing catastrophic thoughts about pain is a cognitive behavioral strategy, right, for chronic pain. And that's also good. We want to do that. And we can cultivate pain acceptance as also a central piece. Okay, this includes things like somatic tracking and pain reprocessing therapy and the way that we attend to and approach the symptoms of pain. These things can be effective and helpful. But they say here, based on the data from this study, the current results suggest potential value in expanding the chronic pain intervention to target emotion regulation more broadly, particularly identifying and describing emotions. Okay, so now we're getting into specifically these emotions and the difficulty that some of you have or people have in this relationship to chronic pain and chronic symptoms. And as many of you know, Dr. Schubiner and Mark Lumley have created what's called emotional awareness and expression therapy. And this has been found through some of the research to have good benefits or good effect sizes in reducing chronic pain intensity, anxiety, depression, and the things we mentioned here that are part of the alexithymia. And compared to CBT, it's been shown in some studies to result in greater improvement in pain intensity and widespread pain. So again, I'm pointing you back to the emotions here. And for some of you, maybe not all of you, but some of you that have difficulty identifying what you're feeling emotionally, describing your emotions, connecting to your emotions, knowing what you're feeling emotionally, you may have this alexithymia. And if you do, what happens is you may be having these physical pains and physical symptoms and not recognizing that you're having emotions. You're just focusing on the pain. Again, the strength is some of the study of this particular study here was was a large online sample of people with chronic pain across the United States. It was they recruited a demographically representative sample of people with chronic pain, different types of pain. Okay. And it says the statistical models in the paper here in the study were robust, meaning they accounted for other things like the baseline pain severity, the pain interference, and sociodemographic variables. So they removed these things, and still the evidence became clear that alexithymia was a significant factor here in the prediction of more pain after 3 months later. Okay. So I hope this helps you guys. It's one of the areas that we work on. One of the areas I work on with people is improving your emotional awareness and recognition of your emotional state and what you're feeling, and connecting that to your physical symptoms and pain, and making an emotional connection and seeing if you have alexithymia or it's a part of you that something we need to address. We work on this individual sessions. I work on this in the group classes as well. It's one of the components of retraining the brain, you could say, into working in a different way. So if you're interested in that, head to my website, thepainpt.com. You can find more information there. I'll continue to put out free content here, such as this study and more, the becoming evidence of the week, to really share with you guys the research, right? What's been happening behind the scenes, because you don't see this stuff, that this is real, that there's real evidence here supporting the work we're doing, and also what we want to do, where we want to put some of our focus for healing. Thank you so much, everybody. See you guys next time. Bye-bye now.